Hello there, students. I am JJ and we will explore diabetes. So, what is diabetes? Diabetes is a chronic mental condition that occurs when the level of glucose in the bloodstream became too high. Glucose in the body primary source of energy and comes mainly from food we eat. The uses of hormones called insulin, which made the pancreas to help glucose enter the cell so it can be used for energy. So as the result, glucose builds up in the bloodstream instead of being absorbed by the cell. This condition can lead to serious health problems if not managed properly. So, in people with diabetes, their body either does not produce enough insulin, does not produce any insulin, or does not use insulin properly. So, let's move on to the types of diabetes. So, types of diabetes have type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes. So, type 1 diabetes, the body produces little or no insulin caused by the immune system mistakenly attacking the insulin-producing cell in the pancreas. People with type 1 diabetes must take insulin every day to survive. Often diagnosed to children and young adults, but it can develop and further. So, type 2 diabetes, the body doesn't use insulin properly and the pancreas does not produce enough insulin. Usually occurs in adults but can develop in children. So, in type 2 diabetes, glucose channel is closed, then insulin resistance contribute to high glucose level in the blood, which causes diabetes. So, next we have gestational diabetes develops during pregnancy, usually disappears after the baby is born, increase of developing type 2 diabetes later in life. Sometimes gestational diabetes turns out to be undiagnosed type 2 diabetes.
So other diabetes, prediabetes is a condition where blood sugar levels are higher than normal but not yet diabetic, while monogenic diabetes is a rare inherited form of diabetes caused by a single gene mutation.
So let's talk about the prevalence of diabetes. So in 2021, 404 million at the age of 45 to 79 years old have diabetes and 128 million at the age of 20 to 44 years old have had diabetes. So 1 out of 10 adults in the world has diabetes.
Good afternoon everyone, I'm Dana Balisacan. I will be presenting to you the causes of the different types of diabetes. So first is the type 1 diabetes. Type 1 diabetes is a chronic autoimmune disease where the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Insulin is essential for regulating blood sugar, and without it, the body can't use glucose for energy. Without it, glucose builds up in the blood, causing hyperglycemia. The condition often develops quickly in children and teens with sudden symptoms. Type 1 diabetes disrupts metabolism by preventing insulin from helping glucose enter cells for energy. Without insulin, cells are starved, leading to fatigue and weight loss. The body burns fat for energy, which can cause diabetic ketoacidosis or DKA. It is a serious and potentially life-threatening complication. Second is the type 2 diabetes. The main cause of type 2 diabetes is insulin resistance. Insulin resistance happens when cells in your muscles, fat, and liver don't respond as they should to insulin. Insulin is a hormone your pancreas makes that's essential for life and regulating blood sugar levels. If your body isn't responding to insulin properly, your pancreas has to make more insulin to try to overcome your increasing blood glucose levels. If your your cells become too resistant to insulin and your pancreas can't make enough insulin to overcome it, it leads to type 2 diabetes. Here is its connection to metabolism. Insulin resistance profoundly impacts your metabolism, which is the sum of all chemical processes that occur in your body to maintain life. Here's how. First, glucose metabolism. Insulin helps glucose enter cells for energy. In insulin resistance, glucose builds up in the blood, causing high blood sugar while cells remain energy starved. Next, fat metabolism alterations. Insulin resistance leads to poor fat storage, increased fat breakdown, high triglycerides, and low HDL or good cholesterol. Next, protein metabolism impact. Severe resistance may cause the body to break down muscle for energy, which disrupts protein balance. Next, mitochondrial dysfunction. Insulin resistance is linked to poor mitochondrial energy production. And lastly, inflammation. It often involves chronic inflammation in fat tissue, worsening insulin resistance and type 2 diabetes risk. Third is the gestational diabetes. Gestational diabetes comes from hormonal changes and the way your body converts food into energy. A hormone called insulin breaks down the glucose from food and delivers it to your cells. Insulin keeps the level of glucose in your blood at a healthy level. During pregnancy, hormones from the placenta can interfere with the way insulin works. It may not regulate your blood sugar levels like it's supposed to, which can lead to gestational diabetes. Here is its connection to metabolism. Gestational diabetes is a metabolic disorder that arises during pregnancy, primarily due to unique metabolic demands and hormonal shifts of this period. Here's how its connection to metabolism. First is the increased metabolic demand of pregnancy. Pregnancy significantly increases the body's need for nutrients and energy, particularly in glucose, to support both the mother and the growing fetus. Placenta hormones and insulin resistance. Placental hormones is crucial for fetal development, also cause the mother's cells to become less responsive to insulin. This physiological insulin resistance ensures the fetus gets enough glucose. Pancreatic response and insufficiency. In healthy pregnancies, the pancreas produces more insulin to counteract this resistance. However, in gestational diabetes, the pancreas can produce enough insulin to keep blood sugar normal, which leads to elevated levels. Next is the fetal impact. High glucose in the mother's blood transfers to the fetus. It potentially leads to a larger baby or fetal macrosomia and increasing the child's future risk of obesity and type 2 diabetes. And lastly, the altered fat metabolism. Gestational diabetes also affects fat metabolism, which leads to higher levels of fatty acid in the blood, which can further worsen insulin resistance and impact overall maternal metabolic health.
Hello everyone, today we're going to discuss the symptoms of diabetes. Diabetes is a chronic condition that affects how your body regulates blood sugar levels. Recognizing the symptoms is crucial for early detection and management. Let's explore the common signs and symptoms of diabetes. The first type of diabetes, type 1 diabetes. Symptoms are frequent urination, excessive thirst or polydipsia, extreme hunger, polyphagia, unintended weight loss, fatigue, blurred vision, irritability or mood changes, fruity smell, breath, nausea, slow healing wounds, bedwetting in children who previously didn't. The second type, type 2 diabetes. Symptoms are frequent urination, increased thirst, increased hunger, fatigue, blurred vision, slow healing sores or frequent infections, areas of darkened skin, especially in arms, armpit, or necks, numbness or tingling in hands or feet, unintended weight loss, and erectile dysfunction in men, of course. Next is gestational diabetes, which symptoms are often asymptomatic. This includes increased thirst, frequent urination, fatigue, nausea, blurred vision, or sugar in urine. Next is prediabetes. Also asymptomatic. The symptoms are darkened skin or neck and armpits, elbows, knees, or knuckles, increased thirst or urination, which is rare, and also fatigue. And lastly are the following, which is MODY, or maturity onset diabetes of the young, and LADA, latent autoimmune diabetes in adults, which includes symptoms that are weight loss, fatigue, and increased thirst and urination. Now that we've discussed the common symptoms of diabetes, remember to be aware of your body's changes. If you experience any of these symptoms, consult a healthcare professional for proper diagnosis and treatment.
Hello everyone, I would like just to highlight some of the physiological effects of the disease, which is diabetes. So here in the type 1 diabetes, I would like to highlight the endocrine system, which means autoimmune destruction of pancreatic beta cells causes absolute insulin deficiency, resulting in the ability to regulate blood glucose and persistent high blood sugar, which means the hyperglycemia. Also, I would like to highlight the effects on the visual system. So microvascular damage to the retina causes diabetic retinopathy, resulting in blurred vision and potential blindness. Type 2 diabetes. So in here, I would like to highlight the effects on the cardiovascular system. So high blood sugar and abnormal blood lipids contribute to endothelial dysfunction, leading to increased risk of hypertension, coronary artery disease, and even stroke. Number 3 is the gestational diabetes. So here, in the gestational diabetes, this highlights the effect on the, especially in the pregnant woman. So I would like to highlight the fetal development. So excess maternal glucose crosses the placenta, causing fetal high insulin levels and resulting to microsomia, or larger than the average baby, which increase the risk of birth injuries such as shoulder dystocia. Okay, next is the prediabetes. So I would like to highlight about the cardiovascular system. So early damage to the blood vessel linings, increasing the risk for atherosclerosis and heart disease. Last is the monogenic diabetes. So endocrine system. So genetic mutations affect beta cell function, resulting in abnormal insulin secretion. This form of diabetes appears in infancy or in early adulthood, with severity ranging from mild to severe high blood sugar. And effects on the other system depends on how well blood sugar is managed. So that's it, and thank you for listening.
So let's see the treatments for diabetes. So the general treatment for all types of diabetes is you have to have healthy diet, regular exercise, and blood sugar monitoring. So different treatments based on different types of diabetes. So treatment for type 1 diabetes needs daily insulin injection or insulin pump because the body does not produce insulin. No known cure, but it can be managed with lifelong insulin and lifestyle control. So type 2 diabetes often managed with lifestyle changes, diet and exercise, or oral medicine like metformin. May need insulin if blood sugar stay high. Sometimes weight loss or surgery can reduce or reverse symptoms. Treatment for gestational diabetes, usually controlled with diet and exercise. Some may need insulin if blood sugar is too high. Usually goes away after childbirth, but it increases the risk of type 2 diabetes later. So that's it for diabetes. So diabetes may be a lifelong condition, but with knowledge, discipline, and support, it can be managed. Remember, controlling diabetes is not about perfection. It's about progress and one step at a time. So, thank you for watching. Don't forget to smile every day and laugh every day and drink your water every day. Stay hydrated.